All right. Welcome, everyone. Thank you for joining. Excited for all of you that are here live with us and for those that will watch the replay. As we are wrapping up Men's Health Month, June is Men's Health Month. So I'm excited to share this information with my team. And we're going to be talking about men's health matters. We're going to be talking about metabolism, testosterone, peptides, and all of those good things that I know many of you men and even women have questions about, have seen it on social media, on the news, and all those things. So we're going to talk about that tonight. And so this will be informative, educational, and we will open up for questions at the end. So for those of you who do not know me, I am Dr. Jessica Chung. I am a doctorally prepared board certified family nurse practitioner. My clinic is based in Tampa, Florida, JC Healthcare and Associates. I have over 15 years of healthcare experience, and I've had the privilege to be able to care for many patients across the lifespan, men and women, through primary care, preventative, chronic care management, medical weight management, and wellness. So throughout my years in practicing, I've also come across treating and caring for lots of men. And those men have been my veterans who have served our country. Said thank you to my veterans. And so through that, I've learned a lot about men's health, and I've learned a lot how men's health really differs from women's health. So I have seen a lot of my men, especially the veterans, come with so many different conditions. And over the years, and I've been able to help and at least guide them in the direction in terms of how to help their health conditions. So I've been able to have that experience and treated and seen a lot of men deal with low testosterone, erectile dysfunction, sleep disorders, chronic pain, cardiovascular diseases. So I have seen it all, and I'm excited to be able to share this information to you all today. We also have Lori Werner. Lori is a certified menopause coach. She's a wellness advocate, and she is the founder of Medical Marketing Wiz, which is a marketing agency that specializes in private practice in concierge medical and aesthetics clinics. Lori does have over 2 decades of experience in medical device sales and healthcare marketing. She founded Medical Marketing Wiz in 2016 with the mission to educate about the latest advancements in healthcare. She does hope to inspire people to prioritize their health and well-being, and her dedication to this cause has made Medical Marketing Wiz a trusted partner for healthcare professionals who are committed to delivering the best possible care to their patients. And we also have Raquel Landry. Raquel is a dual certified family nurse practitioner and psychiatric mental health nurse practitioner. She is the founder of Belux Health and Wellness Med Spa in Lafayette, Louisiana. And as an award-winning provider and national speaker with over 25 years of experience, Raquel specializes in skincare, weight management, longevity, mental wellness, and medical aesthetics. Raquel takes a holistic approach to care, empowering men and women to practice self-care so that they can show up fully for the ones they love. Through innovative treatments and personalized care plans, she helps patients achieve sustainable, transformative results from the inside out. All right. All right. So for this webinar, we're going to discuss midlife health changes in men. We're going to discuss what are peptides. We've been hearing about it, and we need to know and understand what they are. We're going to go over peptides that help with a myriad of conditions: weight loss, help with longevity, joint health, gut health, and sexual health. We will review the health assessment process with licensed providers through LEMD. We're going to discuss the safety, the purity, and the potency of the compounding pharmacy that is used through LEMD. And then we're going to see if it's a good fit for you. And we will go through those next steps on how you can safely access peptide and longevity therapies through LEMD. All right. Thank you, Lori. And I will turn it over to you.
Okay, awesome. Thank you so much, Dr. Chung. So, really excited to be here and talking about men's health. I feel like as women, sometimes we're the ones that are bugging our husbands to go to the doctor and, to focus on health and wellness. And I think this has been a really big trend also for men, right? Over the last few years, we have seen folks like Shaquille O'Neal and Charles Barkley and Joe Rogan and Hugh Jackman and many of these, even Gary Vaynerchuk, Gary V, they're all talking about prevention. And the reality is that many times people think of midlife and they think of women and menopause, but men actually go through something very similar called andropause. And so they see things like decline in their testosterone levels, mood changes, fatigue, hey, I want to go work out, but I'm so tired after a long day of work and I can't get myself to do it. Muscle loss as well, cognitive changes, sleep issues. And so I think sometimes we forget about the importance of having this discussion specifically for men. And again, Men's Health Month, perfect time to be talking about this. And so, as Dr. Chung mentioned, when we think about midlife changes for men, these things typically start to creep up at about age 30. And men often will gain weight starting at that age. The weight tends to carry in their midsection, we call visceral fat. So, this is the fat that surrounds all of your organs in the middle. And this is really the most dangerous type of fat when it comes to health and wellness and, cardiovascular disease and blood pressure and all the other things that go along with that. So insulin resistance, cardiovascular disease, type 2 diabetes are all directly linked to that visceral fat that creeps up in men in midlife. The other thing that you'll find is joint issues and injuries. So the guys that have been, used to playing basketball with their friends, or maybe they were on a softball league, start getting injuries that are much, much more difficult to recover from. You'll also see midlife, all of a sudden, it's like, hey, I got to get a knee replacement. I got to get a shoulder replacement. And a lot of folks just think this is due to injuries, but it's honestly due to many of these things within our systems that decline as we age. And so first, we're going to touch on some of the health risk related to weight gain in midlife. Not to mention the fact, it's obviously annoying when your pants don't fit like they used to, but what comes with that are actually things that are a much bigger deal. So things like heart and metabolic diseases, sleep apnea. I can definitely say my husband, when we were younger, he never snored. All of a sudden, it's like, where in the world is the snoring coming from? Well, it is related to fat buildup around the neck and airway that interferes with normal breathing. And this is where that sleep apnea comes in. When you have sleep apnea, there's all sorts of things that happen. So, actually, when my dad passed away, one of the things that came up as to why he died was prolonged, untreated sleep apnea. He had been snoring for decades, and that ended up causing a lot of other problems. Cancer. Many people don't realize that cancer is related in some ways to weight gain, things like colon cancer. We talked about joint problems. And then also, as Raquel, I'm sure, is going to touch on mental and cognitive health. So, weight gain is also linked to higher rates of depression and also contributes to memory problems later in life. And so when we look at testosterone decline, again, this starts to happen typically at about age 30, where you're starting to lose 1% every year. And often by the age 70 to 80, the testosterone is pretty much negligible. And so now there are more and more options for men to take testosterone replacement. I think it's become not so taboo for men to talk to their providers about testosterone replacement. And there are some peptides that can actually help support your body's natural production of testosterone. The other thing that declines during age is your NAD levels. So your NAD levels, again, are at a peak when we're younger, but as you hit that middle age, we start seeing a pretty sharp decline in NAD levels. And this is linked to energy, being able to manage stress, and we'll definitely talk a little bit more about NAD, which is a extremely popular peptide. So kind of shifting gears a little bit because we want to talk more than just weight loss. We want to talk about really longevity. And this is again a hot topic in healthcare right now is it's not just about the number of years that you live, but it's the number of years that you live free from chronic disease, pain, limitations, so that you can really have the best years and that second decade of life when some of the other craziness of our lifestyles tend to slow down. And so peptides can be a great solution for many people in middle age, both women and men. Now, there's a lot of confusion about what is a peptide. Well, a peptide is actually just a short chain of amino acids that your body already produces. But what happens in middle age is your body is not able to produce as many of them. And these peptides act as messengers in your body to unlock specific instructions. Things like telling your body to repair tissue, telling your body to regulate your hormone levels, or telling your body to optimize energy production. So many times people think that peptides are like a chemical or a steroid or something artificial. They're actually something very natural that you produce in your body anyway. It's just that you're not producing enough of them. So this is why when you used to be able to burn all those calories when you were younger and all of a sudden now you can't, it's because your body isn't producing as much GLP-1. Or you're not as energetic as you used to, it's because your body isn't producing as much NAD as it did when you were younger. And so you'll see, right, that peptides, we hear about them now because you're seeing Shaq talk about them. You know, Charles Barkley, he actually, I will say the guy looks amazing. He is reverse aging for sure. You can see he's got an extra pep in his step, and he attributes that to GLP-1s. Joe Rogan, he's talked about peptides. And the thing is, though, is that peptides actually have been around for more than 100 years. So even though we're hearing about them now and it's becoming more mainstream, the very first peptide that was discovered was in 1921, and that peptide is also known as insulin, right? So insulin is a life-saving peptide for people with type 1 and type 2 diabetes. Another peptide is collagen, right? So collagen has been used in orthopedics and in hospital settings for many years. Even before we started throwing them in our coffee and we were doing all these trendy things with collagen, the collagen peptide was used to repair tissue and help people recover from injury. And so now what has happened is you've got these celebrities who honestly have been on peptides for probably 10 years, and they were very expensive and they were the only people that can afford them. They've become mainstream and the everyday person now is able to access these. So there are over 80 peptides that are actually approved globally. The most common one that we all know of now is GLP-1, which also stands for glucagon-like peptide. So we are going to chat briefly here about four main categories of peptides for men and honestly also for women. Dr. Chung is going to talk about weight management peptides. We're also going to touch on longevity and wellness, sexual health peptides, as well as growth hormone secreting peptides and peptides for joint health. So this is a list. We are in partnership with LAMD, which is a ship-to-home medically supervised telehealth platform that allows you to get peptides shipped directly to you under the supervision of licensed MDs and DOs. They carry a huge multitude of peptides. I'm told they're actually coming out with 26 new peptides this year. So this list will be getting longer and longer. But what we're going to touch on today are really the most popular peptides if you want to get started on your health journey. So I'm actually going to pass it over to Dr. Chung to tie in some of the details and questions around GLP-1s.
All right. Thank you, Lori. So as Lori did mention, Charles Barkley has publicly talked about using GLP-1s and definitely has received or experienced the benefits of using it. And so, as you can see, he's I don't know if he's still considered middle age. I don't know if he's probably late 50s or 60s, but nonetheless, he has been, seen and looking fabulous, wonderful with the weight loss he's experienced with GLP-1 therapy. So, as Lori touched on, GLP-1s are medications that help with appetite control. They help with cravings. They help you feel full sooner. So, for a lot of men, the biggest struggle is not that they don't know what to eat or how to eat. It's that they're always feeling hungry, always feeling tired or stressed or constantly fighting cravings. So like also we have GLP-1 GIP therapy, which is commonly known as tirzepatide. So the way that works differently from GLP-1 is that tirzepatide works on two pathways instead of one. So similar mechanisms, except GLP-1 and GIP therapies help also with glucose balance, fat metabolism, and overall metabolic wellness, and has been shown now to help have benefits with the heart and sleep apnea. And so we'll also talk about that as well. So just to give a reminder, with LEMD, which is the telehealth platform that we partner with, the treatment is provider guided. So the great thing is that if you have a primary care provider, such as myself or for such as Raquel Landry, it doesn't take away your relationship with your primary care provider, but it does help to enhance your wellness, and your primary care provider can still manage you as normal if you are using any of the therapies that are offered through LEMD. So, one thing I want people to do is believe something. I never want people to believe something just because they saw it on social media. So, we always have to look at what is the clinical data showing. And as a consumer, as a patient, you should want to know this as well. This is not just for us medical professionals, but you should want to know what the data is showing. So we have to look at this science. So here is just a very summarized depiction of a clinical study that was done. And it did show that on average, the group taking the GLP-1, they lost an average of 15 to 20% of their total body weight. While the other group that was just doing lifestyle changes alone only lost about 2.4%. So that's a big difference. And, we all come to a realization that sometimes we try to do things on our own in our health, and it's just not working. And it's not because you're doing anything wrong. The way I like to explain how this works with my patients when they are considering GLP-1 injections is I say, think of it as like a metabolic reset. And that's basically what's happening, right? You're in your 40s, your 50s, 60s, your body has been running, all these years, and now you need a reset. And so you think about using these therapies as a reset. So whether you need to lose, or you want to lose 10 pounds or 100 pounds, whatever that is, these therapies have been proven to help. And that it's not just weight loss. It could be improving your blood pressure, lowering your blood sugar, reducing stress on your joints, sleeping better, having more energy, whatever it is. So these therapies have been shown to work. So one of the biggest misconception about GLP-1 medications is that they're just for weight loss, which is not the case. For example, GLP-1, GIP, which is tirzepatide, that is now FDA approved for sleep apnea. Okay, so it's not just weight loss, but weight loss definitely is helping to see improvement in other conditions. So we got sleep apnea. It's also helping with addictions and cravings. Lori often shares a story, maybe she'll share it, of how she had to have like a glass of wine every night. I don't want to make her sound like a lush, but I think it was every night.
It's
If it
okay.
wasn't every night,
It's
I'm sorry,
true.
Lori.
No, I mean it was, I don't know, it was more than I should. And that's like, you think about if it's a glass of wine or it's a beer, right? That's a couple hundred calories. And even if you're doing that, let's say 3 nights a week, no big deal,
Mhm.
3 nights a week, having a glass here or there, that adds up.
It
It adds
does.
up.
It
And
does.
I will echo, I microdose GLP-1s. I have for over a year. And I will definitely say, like, I can have one glass of wine, it's not a big deal. Or I could literally have none. It is not a big deal. It definitely turns off that, like, oh my gosh, I've had a hard day at work. Like, I need to have a drink sort of thought. So I will echo that I do. I mean, and it is backed up by data. It's not just Lori saying
Definitely. Thank
evidence.
you, Lori. So, data is also showing that it's helping with if you're dealing with low testosterone. So, if you are overweight and you are experiencing low testosterone or maybe symptoms of low testosterone, GLP-1 therapies is helping with that as well. Data is also showing that there's improvement with erectile dysfunction. So if you are overweight and you are dealing with erectile dysfunction, you've tried, Cialis, you've tried Viagra, nothing's helping. The studies are showing that with weight loss, there is improved erectile function and also joint pain and mobility. Studies are showing how GLP-1 therapies are helping with that as well. So, although weight loss is a common factor in a lot of these studies and improvements, overall, we're looking at overall wellness, not just weight loss. And you do not have to be, 100 pounds overweight to use GLP-1 therapies. There is something called micro dosing. So if you don't necessarily qualify for the weight loss dosing, you can do what's called the micro dosing. And that is available through LEMD. And I have a picture. If you're a millennial like me, or Gen X, you probably recognize the rapper Fat Joe. He has also been very public with his use of GLP-1 therapies. So I think we're going to have to call him Skinny Joe now. And I mean, like, he is so like trim and thin now that I would be surprised if he's not on microdosing by now. I think he's even smaller than the picture on the right. But he's very, very open and public with his use of GLP-1 therapy. So again, if you are like, well, I just got these last 10 to 15 pounds, I can't, they're not moving, it's not going anywhere. Microdosing may be an option for you as well.
One thing I wanted to just touch on with that, Dr. Chung, if you don't mind me
Yeah.
chiming in, is there may be people that are on this webinar tonight, and maybe you're taking a GLP-1 right now, and you're a little nervous what's going to happen when all of a sudden, okay, you meet your weight loss goals and your insurance isn't going to cover you being
True.
on GLP-1 anymore. Micro dosing is a great step down option to help kind of just keep that food noise at bay,
Right.
continue to provide that systemic inflammation reduction, sleep improvements, and all of that, but being able to still do it in a way that's affordable. And so many clients and patients, that maybe get approved through their insurance for the branded GLP-1s choose to stay on microdosing. So that can be a
Correct.
great option.
That is very true. I will say I deal with a lot of patients that I've been able to help get approved through insurance, but insurance is not. Once you reach a BMI of below 27, you're not considered to use it. But through LEMD, you can use it through the microdosing. So thank you, Lori. All right. So we do have options for those of you, my men, who just are deathly afraid of needles. That is okay. The oral drops are available. And so you can definitely consider using the oral drops. I will say I do recommend the injections. With the oral drops, you have to remember that you have to go through the gut, and then by the time it gets to the intestinal tract, then it has to be absorbed through the intestinal tract. So it definitely is more of a longer and complex um, absorption pathway than to just do the injectable, which the injections is subcutaneous, meaning it's just that layer that's under your skin. It's not a deep muscular injection. It's a little tiny needle, and you feel a little pinch and you're done. But there's options if you want to try the oral drops and kind of see how you feel and maybe transition to injections. You can do that as well. And what I'll also talk about is the additives. So the great thing about using a reputable compounding pharmacy that LEMD uses is that you can choose your additive for your GLP or your GLP GIP therapies. So there is L-carnitine, which helps with cellular energy, fat metabolism, supports endurance and recovery, helps with sustaining energy and reducing fatigue, and it works synergistically with the GLP therapies to boost your metabolism. Then you have glycine, which is an amino acid. It helps with collagen production. It helps support muscle preservation. So if you were one of those that you're like, yes, I want to lose weight, but I don't want to look like I'm sick and I don't want to lose all my muscle mass, then glycine may be a great additive that you would want to consider. It also helps to promote sleep, cognitive function, also helps to reduce inflammation and oxidative stress. So glycine has a lot of benefits. And then B12, which is personally my favorite. B12 is vital to the nervous system and the brain health. It also helps with fatigue and metabolic balance. Helps with cognitive health and nerve protection. So if you're somebody that you're already dealing with fatigue, or maybe you are B12 deficient, it's good to add the B12 to your GLP-1 therapies.
And there's no extra cost for the additive. It's
Right.
actually included, which is great. So speaking of cost, that's always a good question, right? So LEMD is very affordable. And we'll talk a little bit more about the quality and where the peptides come from, which is equally important. So we're not dealing with gray market or black market or research grade peptides here. We are talking peptides that are compounded and so manufactured, compounded, as well as all of the ingredient suppliers are sourced in the good old US of A. So they're not using any ingredients from China. So they're not going to be the lowest cost on the market, but that's a good thing because we're actually using US source ingredients, but they're very, very affordable. So the microdosing, for example, starts at $239 per month. The weight loss starts at $299 per month. The weight loss is on a sliding scale depending on what tier you are, how much weight you have to lose. You can also use FSA or HSA accounts for this as well. So super affordable. And they do try to make sure, it's something that is available to the everyday man. I'm going to hand it over to Raquel here to talk a little bit about NAD and a couple of the other peptides that are hot topics these days.
Yes, thank you, Lori. So, guys, if you want to think about NAD as the cellular energy, or the cellular engine, what it does, like I have men that come into my practice, and they're complaining that, this is what they tell me: I can't rooster like I used to. They're exhausted. They hit a wall by early afternoon, and then they're dealing with massive brain fog. So then at that point, we have to look at the cellular level. So that usually means that their NAD levels have tanked. And what NAD is, it's a coenzyme that's found in every cell of your body. So as we age and as our bodies undergo stress, our NAD levels tend to drop. So NAD is really good not only for stress and anxiety, but it helps with brain fog. It helps decrease inflammation. It helps with the addiction recovery process. It's also good for building immunity, and it has anti-aging properties, and the list goes on and on. It gives them energy, but it also helps you to sleep better at night. So, by bringing NAD back into the picture, whether it's through an injection or through a nasal spray, we wake up with that cellular energy, we sharpen our focus, and we completely change how our bodies handle stress and aging. So, to kind of show you what it looks like in actual real life, this guy right here is one of my clients actually, and this is his 30-day transformation. He's a business owner, he's a contractor, he also owns a gym, so his schedule is like really, really busy. He had the drive to want to be able to exercise, but he just didn't have the energy for it. So his focus was shot, his workouts weren't really getting him anywhere. So we did put him on NAD plus. We also did put him on a GLP-1 and a couple of other peptides, but for him to help get his energy and his recovery back online. So the physical shift is wild, but honestly, it's how he feels that matters. He's much more sharp now. He's sleeping through the night, and he got his stamina back. So, he still comes in to see me. We're now pretty much almost at the 60-day mark right now. And he's just saying how much better he feels. And so this is our transformation from NAD, which I highly recommend. I also use it for myself because I have a busy clinic, and just the stress of managing everybody. It works wonders for me, and it's been a game changer for my life. But lots of men who have those things. Now, I also want to talk about BPC 157 and TB 500. A lot of people refer to it as our Wolverine stack. It's the ultimate recovery stack. So if you want to stay active and maintain your metabolic health, you can't be sidelined by injuries. A lot of guys who come in have chronic pain, and that's usually their ultimate roadblock. That's why this stack is my ultimate favorite, because the way it works is unbelievable for tissue healing. It goes to work repairing the muscles, the tendons, the ligaments, and it even heals the gut lining. So when you stack the BPC, which I just spoke about, with the TB500, the TB500 is what knocks out the acute and systemic inflammation. So if you're training hard, dealing with old energies, or you're just constantly sore, this is going to shift your body from breaking down to rapidly regenerating. So if you look at this testimonial on the right, this guy was 52. He was dealing with shoulder pain. It just wouldn't go away. The workout set him back, and he couldn't even throw his football with his son. After adding the Wolverine stack to his wellness plan, he noticed that his recovery was much faster, his joints felt better, and he was able to get back to do the things that he loves. For me, my med spa is connected to a gym. So I have a whole different clientele of guys who come in. And I can recall this one guy who had similar issues, left shoulder pain, couldn't get his workouts done. We put him on the Wolverine stack, and within days, he's now able to complete his workout. And, just the way he comes in, like shrugging his shoulders, like, girl, I am just so good now. So, this is a stack that is good for repairing, for recovering, and regenerating. And then I also want to talk about the metabolic powerhouse is what I call these two. Tesamorelin, ipamorelin. Some people call it tesamorelin or tesa and ipa. Okay. So when we talk about these, we're talking about body composition, metabolic health, and hormones. These are an incredible blend when they're put together, because instead of just dumping synthetic growth hormone into the body, they actually stimulate your body's natural production. So it works beautifully with your body's natural rhythms to targets stubborn visceral fat, which is that belly fat. It also helps you to build clean, lean muscle mass, balance your hormones, and massively improve deep restorative sleep quality. So if you look at the guy here on the right, he lost 12 pounds, but the scale doesn't even do this justice. Look at the body recomposition and how much lean muscle he put on. But the real win is, he noticed an immediate improvement in his sleep, a huge boost in his mood, and a massive reduction in chronic neck pain and inflammation that he had been dealing with for 30 years. So I'm a big fan of Tessa and IPA when they're combined together.
Awesome. Thank you, Raquel. That was amazing. And those are some great transformations. Definitely not AI generated. Those are real guys, real patients. So I appreciate them actually being willing to share that on the webinar tonight. So another popular stack, Raquel just talked about BPC 157, TB 500. I personally also have used it when I had frozen shoulder. So it's typically going to be an 8-week cycle. So it's not something you have to be on forever. But another combination is combining that with GHKCU as well as KPV. So this is 4 peptides all in one, and it helps with tissue repair, recovery, inflammation, and skin rejuvenation. Because yes, as we age, we get those skin changes as well. So the Clo stack is one of LEMD's newer combinations, but it's great because it also gets you 4 in 1. So from a cost standpoint, also ends up being super cost effective. So Clo is definitely one that is on my list for sure. The other popular peptide, and I will tell you for both men and women, is PT-141. This is a sexual health peptide. It helps with libido, sexual desire, and intimacy. It is available in an injection, but I will tell you the most popular form now is this nasal spray. So as, again, you hit middle age, sometimes we don't like to admit it, but both men and women have, sometimes we're not as excited to, do the thing. And so the issue is that a lot of times it has to do with testosterone, but it also PT-141 can really help. And so for women also, this is something that also helps women. There haven't been a lot of options for women. So this is also something that, if that's something you and your significant other are interested in, PT-141 as a nasal spray is great for both. And I will tell you, I have used it and I definitely recommend it. I'll leave it at that. So now we're going to talk about where the peptides come from. So LEMD, as we mentioned, is a telehealth platform that is medically supervised. So there are licensed MDs and DOs in all 50 states. The beauty of this is you do not have to jump through 50,000 hoops to be able to get access to these peptides because the LEMD doctors in your state are the ones that are going to review your health assessment. And we'll talk about that process in a second. But it is extremely important that if you are injecting anything, if you are taking a pill, if you are doing a nasal spray, that you know where the ingredients are coming from. So the LEMD peptides are produced in a compounding pharmacy called Clover RX in Texas. In addition to that, the ingredient suppliers, the raw materials come from Illinois. Both the pharmacy as well as the ingredient suppliers are FDA inspected facilities. Every single peptide is verified for potency. So they're verifying that whatever they say the dose is, that it is actually that dose. You will not find that with some of these black market and gray market peptides. So you can feel good. These are triple and quadruple filtered for contaminants. And the pharmacy is actually accredited by the National Association of Boards of Pharmacy, which is voluntary. So very high quality sourcing, good old fashioned made in the USA. And let's face it, right? There's a lot of places, there's a lot of these online telehealth platforms that are out there just to kind of show you a side by side of LEMD versus some of the others. Again, everything is supervised by a physician. All of these physicians, MDs, DOs, nurse practitioners, and PAs are certified in peptides. they're personalizing the dose specifically for you. So unlike some of these preloaded pens where people tend to sometimes get too high of a dose, this is where you get the side effects. You can get the Ozempic face and that sort of thing. Because the health assessment form is completed and because they are compounded specifically for you, it's that personalized prescription dosing. These, again, I mentioned pharmaceutical grade. We're not dealing with research grade or black market peptides. And the vials come pharmacy prepared and ready to use. So you don't have to do any sort of at-home mixing or anything like that. So it also comes with all of the pricing, includes your shipping, your tax, if you're doing injectables, your needles, syringes, alcohol wipes, everything included in one. There's no hidden fees and there are no membership fees. So basically the way the patient journey works is you will get a referral link. So if you're Dr. Chung's patient, you'll get a referral link from her. If you're Raquel's patient, you'll get a referral link from her, or whoever it is that you invited to the webinar or who invited you to the webinar tonight. They will get you a link for you to be able to sign up for your free customer account. Again, you don't have to put your credit card number or anything. You're not signing up for a membership. You're going to create that free customer account. That is important because you cannot see all of the peptides that are available to you unless you are logged in. So if you're looking for BPC 157 and you're like, where is it? It's because you do have to create a free customer account. Then you are going to choose the products. Now on the website, there is a peptide quiz. So if you're not really sure which one is best for you, there's a simple, I think it's a few question quiz that you answer some questions and it'll actually tell you what peptides are recommended for you based on your answers to the questions. Once you pick your peptide, you are going to complete a medical intake form. So this is a simple form that's going to ask some health history questions, look for what other medications you're on, and the doctor is going to review that and just make sure there aren't any contraindications or reasons why you wouldn't be approved to take this peptide. Remember, these are chains of amino acids. There are not a lot of contraindications for them, but we do want to make sure that it is safe for you to take. So from there, it is going to be shipped directly to you with everything you need to get started. And then there is a support line. So if you have questions for the doctor, you have a side effect, you have, anything, any questions at all, you have a direct portal where you can message the provider as many times as you want, no extra charge. I'm going to hand it over to Dr. Chung to close it out.
All right. So we covered quite a bit of information in these 40 minutes. So we explored these peptide therapies, as Lori mentioned. These are chains of amino acids. So you truly should not have to worry about, this is another medication, something that is just been, combined in a bunch of chemicals. These are peptides that we naturally have in our bodies, and as we age, our production of them decline. So it's like you're adding to what you already have. So the most important ones we talked about is the ones that everyone has mostly heard about, or maybe you haven't heard about them but now you have heard how they can help you with metabolic health, sexual wellness, longevity, and joint and musculoskeletal conditions. So just like anything, it's not going to just happen overnight. You do have to stay on the peptide therapies for the recommended time of treatment. Some are shorter than others. Some you would do in cycles. For example, the GLP-1s, you really don't want to do it, or at least be on it for less than 3 months. You have to give it at least 3 months to really start to see results. Other ones you may do cycles of 8 weeks and so on. But they do help with energy, improving body composition, recovering performance, and improving your overall wellness. So if you would like to explore any of these options that are offered through LEMD, as Lori mentioned, you will reach out to who invited you to this webinar, whether it was myself or Lori or Raquel. or maybe you just found it on social media. If it was posted, reach out to the person that posted it, or the original page it was shared from. If you registered, you'll also receive an email with the next steps on how you can place an order. All right, so we're also going to open up now for a few minutes for questions. And there was a question that was put in the Q&A. You can type your question in the chat box. Let me make sure it is enabled. All right, so the chat box is enabled.
Okay, Dr. Chung, I see one here just about, okay, I'm nervous about the injectable GLP-1 versus the oral because it might stay in my system longer if I want to change my mind. So could you talk about that? Like, do these drugs or do these peptides stay in your system for a long time, or is there any concern with if somebody wanted to stop? How does that work?
So let's start with the injections. The injections are once a week. So the only way it's going to be able to be sustained in your system and be effective is if you do the injection once a week. Even if you're like 1 or 2 days late, you can really feel the effects, especially the GLP ones. So, for example, if you're like a day or two late, you're going to all of a sudden be back to craving junk foods and feeling extremely hungry. So, you want to ensure that you stay on schedule. So, with that being said, that shows that it's not, so to speak, staying in your system. Anything you introduce into your body in some way, form, your body's metabolizing it, it's breaking it down. So that brings you to the oral. If you were to do the oral drops, you still have, it still has to go through your GI tract into your intestinal tract, and it will go through your gut to be absorbed into your bloodstream. So that takes longer to have an effect than the injection. So, but if you were to stop the oral drops, then you would still have the same effect. If you stop taking it, you would lose the benefits, obviously the appetite suppression, the cravings, and whatever. So, no, it doesn't stay in your system forever. You're not going to get any long-term benefit if you do the injection or the drops just, for a couple weeks or something.
Okay. The other question here is about BPC 157 TB 500 injectable. Now, the person says nasal spray. There isn't actually a nasal spray of BPC 157 TB 500. There's an oral formulation, so a pill, and then there's also an injectable. I can speak to this just, again, my own personal experience with it. I did the injectable because they do say if you have an injury and you inject it like near your injury. So mine was in my left shoulder. I was injecting it kind of under the skin near my shoulder. So you can get a little more specific with the injectable. I will tell you, my mother, who is 75 years old and needed a hip replacement, she has taken, I think she's on her third round. She's done just the pills. She canceled her hip surgery. So the BPC 157 TB 500 oral version is going to be, it does help with the gut lining as well. So if you're taking it more for gut health, you may want to consider the oral version of it. So I don't know if either of you guys have any other thoughts on that. That's a good question.
I think I'm going to let Raquel add to that.
Oh, you're muted.
Sorry, guys. I think that's a great question. Both oral and your injectable can be effective. However, I agree with what Lori said. It all depends on what you're taking it for. Because, like, for example, the guy that I had with the left shoulder injury, same thing. I would literally give it in his left arm, and within a matter of days, he had basically had some relief. So, I think, they're both going to work. It's just the injectable is going to work quicker. But like, like I said, or like you said, Lori, if they're taking it for more specifically for gut health, then it doesn't necessarily, pertain to, okay, I need to give it in this site or that site. So,
Yeah, you're going to get
that
more like systemic benefits with the oral. One
correct,
of the guys on my team at work got it. He's had a lot of stomach issues. I think he even had like an endoscopy and they found like a small stomach ulcer. And he did the oral version of it for that reason, for healing the gut lining. So
correct,
yeah, but no nasal spray for the Wolverine stack, just the injectable or the oral.
correct.
The other one we did not go over, we talked about tesamorelin, ipamorelin. There's a sister to that called samorelin. Samorelin also is available. So this again is a secretagogue, stimulates your own body to produce your own growth hormone. That one is also available in an injectable and an oral formulation through LEMD. So samorelin instead of tesamorelin, but you'll see that on the website.
And
Absolutely.
then sometimes I have people who are just afraid. I didn't mean to interrupt. Who are just afraid of the injections, so then oral is another option for them. But like I said, depending on what your need is, the injectable will be a lot more of, not to say more effective, but it will definitely work quicker.
Absolutely. And there was another question that I answered with a reply. Someone asked, is PT 141 for both men and women? And that is a yes, it
Yes.
is.
Yeah, I mean, again, this is off label, but I ordered one bottle and my husband and I share it. It's just a
There you
nasal
go.
spray. I don't know,
Right.
that might not be right, but whatever. I'm just being honest here. So,
Right.
yeah, both, you can get a little like sniff before bedtime.
There you go. So yes, it's both for men and women. And just to remind you, when you receive the referral link, you have to create that free account because some of these products you may not see it unless you have an account. And the great thing about the website is when you click on a product, you literally see all the ingredients, what it's useful for, contraindications, so you can see all that, and of course pricing. So definitely take the time out. When we end the webinar, we'll send out an email, and or you just simply reply to the person that invited you, send a reply and just say, hey, can I get the link, and we'll get that to you. But make sure you take advantage of creating that free account so that you can see everything on the website.
Yep.
All right, let's see. Is there any other questions? I'll just give a few, about 30 seconds or so. If you have a question, you could type it in the chat box or you can type it in the Q&A.
Yeah, my husband just got on. So he's been doing the GLP-1s for maybe like 6 months. And if we go back to John's, we had him on another webinar. When we saw this, he was like, babe, ordered me some tesamorelin. So this is actually one of my very good friend Mary's husband. I actually went to college with him, so I know exactly what John looked like. He's back to looking like he did in college. So this is also a super popular one for middle-aged men, the Tesa-IPA combination. So that's actually a
Even his face looks younger. Like, just forget
yeah,
the body, just neck up. He looks, his
yeah.
face even looks younger.
Yeah. And he really isn't overweight. It really was more for that visceral fat, and
Yeah,
it's like you're putting hard work in the gym. I mean, and it's really frustrating when all of a sudden it's like you're not seeing the results. So this is a
right.
great peptide that just helps with muscle preservation, muscle growth. A couple of webinars I've had, I actually have a client that's also a brand partner that owns a DEXA business in Lansing, Michigan. And he actually did 2 months of tesamorelin and measured his DEXA, which does a complete full body composition analysis,
Right.
and was able to show, not just by looking in the mirror, but actually with data, that he reduced visceral fat and increased, I think he gained like 6 pounds of lean muscle mass. And when
That's
you gain six
crazy.
pounds of lean muscle mass, you burn calories a lot easier as well. So, yeah,
Well,
I'm
speaking
excited.
of brand partner, Lori, someone may be on here and they're like, listen, I want to share this with some people. Can you talk about the brand partnership with LEMD as well?
Sure. Yeah. So we don't have any slides on it, but I'm happy to touch on it. So yes, so for example, like, Raquel is a business owner. Maybe you own a gym or you are a health coach or you're a DEXA-based business, or honestly, maybe you're just a guy that loves to work out and has a lot of buddies that would love to offer peptides. LEMD does have a partnership. You can sign up as an individual brand partner or a business. The cost to be a brand partner through this company is only $79 one-time fee. And there is just the only ongoing fee is $8 a month for a website that they give you for people to order peptides through. But if you are someone that is interested in being a brand partner, it's also a way for you to get your peptides 20 to 40% cheaper, as well as being able to share this and give, your clients, your neighbors, your friends, your siblings, whoever it is in your world that wants to get on the health and wellness journey, give them access. Again, at the end of the day, medically supervised, compliant, USA made peptides. That's the biggest thing because, sometimes for ourselves, I know for me, I had taken research grade peptides, and that's fine for Lori to do, but I'm certainly not going to tell anybody else to take something that is not medically supervised. So when I heard
Right.
about this, I was like, listen, I want to be part of this. And with the network I have, it makes sense. So yeah, brand partnership is something that is definitely available. Again, you can get back to the person that invited you. If that's something you're interested in, they can definitely tell you how to sign up. It's a very simple process. It takes like 5 minutes. So great question. Yes, I'm glad you asked that, Dr. Chung.
Thank you. All right, everyone. Well, thank you so much for joining and for tuning in. And again, if you have any questions, reach out to the person that invited you. And we will continue to do these webinars. So you'll get, emails from myself or Raquel or even Lori and whoever, because this is definitely a growing aspect in health and wellness. And it's helping a lot of people. So thank you so much. And we will see you soon.
All right. Thanks, guys.
Thank you.